I'm Doug Schell. I'm a clinical nurse specialist, one of the types of advanced practice nurses, and I'm a multiple sclerosis certified nurse. And I came into the field of neurology and MS in a roundabout way, did a lot of other things before I came here. Started off, got a degree in psychology, and I worked at a mental hospital, a psychiatric hospital as a social worker. Then I went to nursing school, became a nurse, worked in critical care, worked a little bit in nursing education, nursing school, a little bit of teaching and supervising students in nursing school. And I've been working at MidAmerica Neuroscience Institute since 2000 and have developed a focus on MS care in those years and have got my certification in the multiple sclerosis nursing. And although this wasn't what I set out to do in my professional career over the last 9 years, I've really become very involved and committed and dedicated and focused on MS care and found it to be a very enjoyable and rewarding area to practice in and work with patients in. At MidAmerica Neuroscience Institute, MS is really one of our passions and our areas of focus that we really are dedicated to. Here we have kind of a wealth of resources here available to patients with MS. We have providers who are certified in MS care and really spend their time focused in that area, learning about the newest developments in that area. Our physical therapists, for example, don't spend their time working with patients who've had hip replacement surgery and knee replacement surgery. Although they know about the hip and the knee, they spend a large percentage of the time working with patients specifically with multiple sclerosis and with some of the common problems, especially with walking and balance, that MS causes. They're really focused in that area and really expert in that area more than any physical therapist in any clinic on any street corner. We also have a research department here which conducts research trials in a variety of areas, but the majority of these are in the field of MS and let patients have access to treatments and care that they would not otherwise have and have options available to them that they would not have elsewhere. Just in a number of ways, we've really focused on MS, dedicated ourselves to that area, and are able to offer patients things that would not be available in other clinics. The field of treating MS has really undergone a revolution in the last decade and a half and is going to continue to evolve, and probably at a very quick pace. We've gone from having really no available treatments to treat the underlying disease of MS in 1992 to having 3 proven medicines when I started working in the field of MS. We call them the ABC drugs, Avonex, Betaseron, and Copaxone. We've now expanded to having 6 proven treatments that are FDA approved for MS, and we have a whole wealth of other treatments that can be used in clinical trials that are experimental drugs. And really we've gone from having no treatments to having the ABC drugs to really now facing an alphabet of options for patients with MS. And besides the 6 FDA approved drugs that are currently available, many of the drugs that are and treatments that are undergoing clinical trials now are likely to come on the market and be approved by the FDA for broader use among MS in the next several years. And this is going to be a very interesting time. It's going to offer a lot more options and choices, things that might be more convenient or work better than choices we have now. And it's also going to be more challenging because of those choices and trying to fit the right treatment, right medicine to the right patient, and weigh the possible benefits that can come from all these treatments and the proven benefits that can come from all these treatments with the possible costs and risks and side effects of these treatments. So we've seen a lot of evolution. We're going to continue to see a lot of evolution in the future, and it's going to be a very exciting and also a challenging time to deal with MS. MS is a disease that has been described by two key words, unpredictable and variable. And that makes living with MS a challenge, and it makes treating MS a challenge. Really, every patient with MS is unique. MS varies from patient to patient. Within the same person, it varies from day to day and year to year. And while everybody has good and bad days in their life, people with MS really have good and bad days. And managing all that change and that variability and that individual variation between people with MS is both something that's exciting and challenging, like many of the things that have to do with MS. Because of that, we really need to try and develop a close relationship with patients with MS, see them on a regular basis, monitor how they're doing on a regular basis, test their functioning on a regular basis, kind of get to know who they are and how MS affects them, so that if their MS changes or starts affecting them in a different way, we're more likely to be able to pick that up and deal with it.